Now, the National Association of Resident Doctors, NARD, suspended its strike on Thursday morning. The suspension was announced after a meeting of the executives of the association.
Now, but doctors will meet in 2 weeks to review how far the government had gone in honoring the agreements reached.
Well, joining us in the studio is a medical doctor, Dr. Tui Mebamodu. Good morning and thanks for joining us.
Good morning.
Nice to see you again.
Yeah.
Okay, so the doctors are saying that they will reassess the situation in 2 weeks. I wonder what meaning we should read into this.
Again, it's a repeated experience in our own health system. We've witnessed a recurrence of strike every time. In fact, you can really point out that the health sector is one of the sectors most besetted with strike. As doctors are, returning to work, UHESU is actually serving, another strike notice to the federal government. So for us, this will continue. The cycle will continue. There will be strike. There will be call-off, there will be strike, there will be call-off. It's going to be like that in the health system for a long time. These are why. First of all, the government, will always negotiate and discuss with the doctors, which is very good. And the government will end up signing a collective bargaining agreement that will not be sustainable to a large extent. So they sign a collective bargaining agreement. Then at the end of the day, you won't honor the collective bargaining agreement. And then the doctor will say, okay, you signed this paper. Why are you not honoring it? So to a large extent, there's what we call a deficit of trust between the government and the agency responsible and even the people working with them. So when it gets to a point where you sign and you don't honor the agreement, of course, we know that the only instrument you can use to make you honor your agreement, one of the instruments is to go on strike. And that's why the strike will continue. Now, secondly, if you look at the health system, it's such that there's a challenge of leadership, in the health system and management. Because if you look at those people heading the various hospitals, competent, effective doctors, wonderful people, who have gone through a lot of trainings. But the core training that will make you a good management, be able to resolve conflict, be able to navigate through some of the complaints these doctors are, the workers, not just doctors now,
yes,
are talking about, you may not have the skill. Now, because it has always been that government employs us, they send money, we get paid, whether we're having quality or not. So now it's been a place where we are expecting a more efficient management and leadership system in the health sector.
How bad is it in that area? Is that really at the root of this
again,
challenges that you have in the health sector? Apart from the fact that government, seems to rescind on its own side of the bargain every now and again.
Look at what the doctors, the National Association of Resident Doctors were asking for. Pay our standing salaries.
Allowances, yes.
Where is that? At what level is that? That's at the level of management and leadership. Enroll us in IPPIS, the integrated platform of payment. Where is that level? That is at the level of leadership and management. Because you see, now, skipping this thing, well, that may be at the level of government, but with proper leadership and management, that thing can be understood clearly. Okay? So, if you try to compare experiences across similar health systems, we'll find out that people had actually honed in to retrain and train their doctors or the headship of health institutions on these key areas. And of course, that is extremely lacking in the training of doctors. We are just trained to stay in the hospital, to treat patients, get your salary, and go. Now, as this thing is evolving, we're going to see the conversation being extended to public domain, to every domain, because at the end of the day, everybody's affected. Yeah. Now, why will you employ people and sign an agreement and not honor the agreement? It's unconscionable. You can't really give reason why that should happen.
All right. Now, let us even understand. We have seen instances where the Nigerian Medical Association they have their demands sometimes and they go on strike. They've threatened strike in the past. It is not them this time. It is resident doctors. Now, resident doctors are suspending their strike. Johesu is talking of going on strike. What are the differences between all of this when what they present is still almost the same thing?
Yeah, again, if you look at it, the Nigerian Medical Association is the umbrella association for all doctors, whether you're resident doctors, those are undergoing postgraduate training, whether you're in the private sector, whether you're in the public sector. NMA, is the umbrella organization for all of you. But interestingly, National Association of Resident Doctors and Medical Guild of some various states are used as an instrument for NMA to press home some of their demands in terms of getting doctors well. Now, we used to have different associations under medical union before, you understand? The Nurses and Midwife Associations, the Laboratory Scientists Association, the Pharmacists Association. But suddenly, there was a kind of gang up, let me use that word, in quote. And they formed what they call Joint Health Sector Union, which they call
gang up against
because the intra-workers squabbling is increasing every day. So people come and say that doctors, it's not compulsory for you to provide leadership for the health sector. We can also provide leadership. Doctors, you do this, we also need this amount of money, close to your own. So again, at the heart of those intelligence squabbles is that, you see that people are really struggling to get hold of leadership of the health system and get equal pay or near equal pay to doctors.
So in other words, they don't have confidence in the leadership of the health services sector, and that's reflected in all the multiple unions that you have, apart from the NMA.
Yeah, those unions find out that, well, doctors are always the head of the medical institution, and they want also to be head of the medical institution. There are other issues concerning who has laboratory, because as a medical doctor, you can specialize in laboratory technology. And then there are other laboratory technology and laboratory scientists who are also there. They want to head the laboratory. And doctors say, listen, you cannot head it. We have also we've done further training to head. So this is all about greed and self-centeredness? Not necessarily. And then again, the press is not even helping the issue. And I will explain. When the press is intervening or discussing the challenges of doctor strike, they always look at it from unpalatable labeling. Egoist doctor, selfish doctor, they're not holding on to Hippocratic oath. There is hypocrisy here. Again, the press has not gone to the extent of looking at it and saying, listen, what are the actual issues here? How do we, contribute to this discussion in such a way that we can really provide solution, concrete solution, and look at where to hammer? But again, I can understand in our climate, everybody wants to talk politics, everybody wants to talk money, and then everybody wants to talk church. So we're not seeing that flow. You understand? We're not seeing that flow of looking at the critical sector like health, and journalists understanding what exactly these people are clamoring for. And of course, we doctors, we're poor communicators. Okay, we cannot actually, engage, for instance, the government agency. Doctors cannot engage the public in trying to, really clarify a lot of issues there. But you will find out, it appears that what is causing the strike is money. No. If you look at it, I studied that was done.
But that seems to be the case. I mean, look, I will allow you land on that. You talked about training, which is very, very vital, both at the leadership and the management level. But as soon as government releases some funds to pay outstanding salaries, the skipping entitlements, and all of those that have to do with money, the doctors go back to, they go back to work. They don't insist. I mean, part of the things they've been complaining about, this 6-point demand, the conditions of the hospitals, not enough, working tools, even where there are, very poor working conditions and all of that. They don't emphasize that.
Again, if you look at the reform agenda, if you really want to reform health system, there are knobs, there are things you tune, finance becomes one of the, financing is the key thing, because again, you need
financing for salaries.
Not financing in various areas, including salaries. They are high-tech job that requires remuneration. They are high-risk job that require remuneration. I'm talking about even health workers now, not just medical doctors. It's important. Then for you to put up proper hospital, you understand, it's another finance, very expensive equipment. To put up the process, very expensive. So, Then organization becomes another knob when you want to reform. You have to say payment methods. Where is money coming from? Who is paying and how are they paying? Then you have to look at behavior. How do we, engage, and then regulation. So these are the key things you need to look at in the health system. Now, you can really be assured that in an environment, in our environment here now, it seems to appear that as if the money is the core issue, because that is what everybody's trying to, hold on to. But I can tell you, even through thorough discussion and through researches, we find out that the leadership and management issue is at the core. But how will you explain all those things? Because if you look at the money we're talking about, these are the issues that can really be resolved. The chief medical directors of those hospitals act like tin gods. You understand? They are recalcitrant. They cannot be corrected. It's a democratic. You don't even do audit, proper audit, and audit and open audit and presentation of the account of these institutions to the public for scrutiny, so that we know what you are spending on.
Of course, we recall in the case of Luth, for example, there was this face-off between doctors and the chief
and the management.
medical
and that's how it
director.
integrates itself everywhere. Now, let's tell you what, all of us, we're going to bear it. Now, all this thing we're saying is mainly in the domain of the public health system. And which domain of the public health system? The secondary and the tertiary domain of the public health system. But again, the core area that we need to focus on and start to think about is the primary health system, where most of the negative indices are domiciled. So what we've seen exactly is that everybody's been looking at it at that high level. For me, the core thing, because if we're not careful, the health system is degenerating already. It's going to go down in a spiral. It's going to go down. I'm not just about doctors now, but it's also about the JOHESU, the nurses, the pharmacists, and the lab technician. Everybody's just looking at spoiling for strike.
All right. Now, one of the demands by the resident doctors points to the issue of corruption in the system, within the management level that you have also talked about. Now, if that is so pronounced, would you blame government for not meeting them at the demand whenever as it's supposed to be? Again, or do you think government is also cashing in or taking advantage of that loophole?
Again, you see, we must not always look pointing our fingers in a way at the government, because there are different levels of functioning even in the whole government system. Labor ministry, health ministry, and here we are, where we are local. I'm talking about the management of those hospitals. Okay, that's where we're local. That's where action should be. That's where engagement should be. That's where conflict resolution should be. That's where transparency and motivation should be. And that's where, assuring that we're paying, we're paying for quality. That what the money we've put into it, we are receiving.
And that's where failure is most pronounced
and
right now.
And then listen, and let's be factual here. We've put money to health. It's nice to throw money at things, but again, if you throw money at things recklessly, you may not actually get a result. You've put money, salary has increased. When I started practicing as a doctor, I was collecting maybe 460 naira, until the thing, per month, until the thing now got to where it is. But you can ask, you need to ask the question, are you getting sufficient bang for the bucks you are putting in? Are you getting result for those things you are even doing? Then again, if you're not getting result, you need to sit down and think. We have national, health act now, which was signed in 2014 by Goodluck Jonathan. We have not even domiciled it and really step it down to the state level and look at how to really put the content of this thing and use to drive health system. So again, there are critical issues that has to do with management, that has to do with leadership, apart from the fact that you need infrastructure, apart from that you need salary, apart from that you need to maintain harmony. We need the different people working within the health system.
Now, that localization of the health sector still speaks to the issue of the restructuring that they've been talking about, instead of this highly centralized system. Now, I want to go back to the primary health care that you mentioned. We do recall that under the late Olikoye Ransom Kuti, a lot of gains were made, when he was the Minister for Health. He actually focused on the primary health sector. What happened that we lost, all the gains that were made?
You see, the political incursion, I think I've mentioned this somewhere, that the greatest challenge the health system is facing is health politics. The greater challenge of health policy is health politics. Now, the politicians look and say that, listen, because we need to, because of the return in terms of building and all those things, we need to build structures. We need to build houses. We need to build those things. When you build those things, if you are not manned by equal human resources, it is not going to work. It's not going to change anything in your health system. And look at it. Most of the negative indices we are getting in health system in this country comes from the rural areas, those primary health centers. That's where we're getting there. So again, it is hippie for the politicians to say, okay, I have buildings, I have bought equipment, because at the end of the day, personally, it's going to come to them. But at the end of putting in all a process, you know, an input process, an outcome, you know, that will be beneficial to the people is another thing entirely. It can't be the same way. But at the end of the day, you are going to see, because let me do some predictions here. Gradually, if we're not careful, the public health institution will become irrelevant. Let me give you an example. If, for instance, if you provide adequate light in this country, and you can synergize people to do real practice, they will set up the cost of because what is attraction to that public health institution is the cost. If the cost of the health can be brought down, and you see somebody who can come and disrupt the market, like Tesla is disrupting the auto industry now, you will see a radical change in the health system. And then, as much as patients are not coming to the public institutions, government will have reason to even rationalize some of them and lay off the doctors and the nurses that want to go on strike. So again, we doctors, we health workers, must be able to start thinking. We must be able to look at health 2.0. Where are we going from here? And then you are going to see a lot of coalition of patients who will demand that, listen, I'm facing this problem. You are going to see lawyers queue behind them and saying that, listen, you've done something wrong, and then come and account for it. The law will be tested in various ways. Okay. And it's better that doctors, nurses, pharmacists are prepared for this coming changes. Dr.
Tuyi Mebawondu, thank you so much for giving us insight into all of those this morning.
My pleasure always, man.
Thank you. Yes. Right.